Hello, and welcome to Talking Treatment, the podcast for everything in the field of mental health and addiction treatment. Join us in listening to our episode as we will focus on highlighting industry trends with guest experts and healthcare providers from around the nation in the treatment industry who will share their unique perspectives on treatment. Ending the stigma on behavioral health and substance use disorders is very important to us, and the easiest way to do that is by talking about it. That's Talking Treatment. Today, we have a special guest from Antioch University, Dr. Vincent Pignatiello.
Welcome, Dr. Pignatiello. This is Coletta Dorado. I'm CEO and founder of AZZLY. Very excited to have you on board. And this is the Antioch University New England location. Is that correct?
That's correct, yeah.
Great. So please share with us in the audience just exactly what you do as director of the Psychological Services Center there, and you're chair of the Department of Clinical Psychology. You wear quite a few hats up there, I understand.
Yeah, absolutely. Antioch definitely trains us to be able to serve in multiple roles in psychology, and so I definitely wear a few hats. So yeah, as the director of the Psychological Services Center, we're at the training clinic for the Department of Clinical Psychology at Antioch University, New England. And our goal is primary to train students to become psychologists. Often students tend to come to the PSC in their first or second clinical rotation while in the doctoral program. And one of the things that we do as a training clinic is we try to teach students to think professionally, to think psychologically, and to think ethically, train them for the various roles that students ultimately end up in as psychologists.
So Dr. Pignatiello, during pre-COVID, let's talk about, was your training on site and within the clinic more so than maybe what it is today? Have things changed?
Yeah, so pre-COVID, training is regulated by Clinical Psychology's Guild organization, the American Psychological Association. So all of our training does need to be in person, face-to-face. Obviously, with COVID, it's led us having to think creatively about how to continue to train students while also keeping students and patients safe. And so we have moved some of our services online through remote services like telehealth for our therapy program and a hybrid model with some individual face-to-face work as well as some then remote work, say in our assessment program.
And you know what we still find, doctor, is that within behavioral health, mental health, addiction treatment, it appears that a lot of the funding dollars through state or federal funding in order to support programs, to support education, to support treatment, even within the patient population in the community, that this sector of healthcare was underserved. It is impressive upon us how many programs that exist out there are still paper-based. So we really are excited and encouraged that at the university level, more and more teaching clinics are reaching out for modern technology or platforms in order to better equip healthcare providers in this sector to really, number one, make a living, number two, provide better outcomes, and really serve the new mandates that are coming down. Do you pretty much cover a lot of that in your training?
Antioch University has very much of an environmental and social justice perspective. And moving away from paper files, for instance, given the laws around HIPAA and maintaining records for an extended period of time, paper, for instance, isn't always the most effective way to do that and has an environmental cost to it. And kind of like in terms of our own training around telehealth, even prior to COVID-19, there's a social justice component of that. Being in New Hampshire in a very rural state where we don't actually have any major east-west interstates, for instance, so traveling across such a small state can even take a couple of hours. That is a way to kind of expand access to healthcare has always been a focus of the program. In fact, the clinical psychology department started with a social justice focus back in the 80s to provide increased capacity for psychologists to serve in rural areas like New Hampshire. And so using technology has been one way to help achieve that goal and move towards a more equitable capacity to serve the community.
So the services that you offer and the clinicians that you're training, they're not only serving your student population, but they serve within the community. Is that correct?
Correct. Yeah, we serve both as the mental health clinic to the community. So this goes well out into different parts of the state of New Hampshire, as well as to the majority of or parts in New England, so including Vermont, Western Massachusetts in particular. And we also then serve as the College Counseling Center for Antioch University, New England. So other departments are able to have their students receive services at the PSC. So we serve kind of as a broad community health center and college counseling center at the same time.
Well, that's wonderful. That's excellent. So, Doctor, have you been able, through the use of technology, would you say, are you able to serve more of the community or more of the patient population that needs this care? Has technology helped you expand who you serve?
I think one of the unfortunate benefits of COVID, if I can name it, is that has been that it seems like the industry has been willing to reassess previous limitations around people accessing care through telehealth. There are a number of licensing laws and legal issues that have made practicing in a small state like New Hampshire problematic, because someone who lives out in Vermont, which is only a 30-minute drive from where Antioch is, or Western Massachusetts, again, a 30-minute drive south, wouldn't have been able to access telehealth services because we crossed state lines.
So what you're saying is, because I believe here in the state of Florida, where AZZLY is based, the state of Florida, who is really strict with licensing, and anyone who does move to the state or wants to provide services has to follow a pretty strict mandate on process and procedure in order to get licensed to serve here. But my understanding when it comes to telehealth, that they have relaxed that rule with the understanding that some family members or students have moved back home or are working remotely or doing their classes online, and allowing for treatment to continue with those providers that might not be located in the state of Florida. So you're saying within your community of all your states touching each other, that the states also have relaxed some of those rules so that you're able to serve in various states versus where you were more restricted before? Am I understanding that correctly?
Correct. There have been a number of executive orders and temporary changes in some licensing laws that have made it easier to work across state lines during the public health emergency. Some states, for instance, have put processes into place to facilitate obtaining a temporary license to see patients in neighboring states via telehealth. This has been particularly helpful for us in New England, where we have 6 states that combined are a little bit bigger than the state of Florida. But with all the continuous borders, it makes it challenging if patients live even half an hour away. It's been important regardless for us to stay up to date on the changes in each of the laws in the states.
Yeah, it definitely is a challenge, obviously, with HIPAA and the concerns that go along with that. It absolutely makes sense. So that's really exciting, though, the fact that you're able to continue, grow, serve more, serve not only your students' needs, but also continue to serve in the community. So talk a little bit about, what you're seeing as far as your student reaction to technology. Is it a different generation, or what's the typical demographic of that are part of your groups that you teach?
So we feel really fortunate in the clinical psych program at Antioch, where we have a pretty diverse group in terms of age, for instance. We have some individuals who are coming in right out of undergrad, some who've received a master's degree, and some who are engaging in a second career change. And so in this, we have a lot of diversity in terms of engagement with technology. And so while many are technology native, many others are still kind of feeling their way through working in a different way. And I think regardless of any sort of change, there's always issues of workflow, things that work in paper or work in person, that new workflow processes need to be developed for. And so kind of working with these different ways of helping student clinicians think professionally about what the workflow means, so they can dedicate more of their time to working with patients, and as much as possible, reduce the amount of time that's needed on things like paperwork. Conversely, we try to have students think too about how to use technology as a way to expand their awareness around psychological issues. And the affordances that exist through telehealth, or the ease at which someone can reach patients now, although we don't allow this at our clinic. We know that some practitioners in the community use texting and other ways to get a hold of patients. And so recovery apps and other things have allowed for more frequent contact with technology. And so our students are having to learn how to navigate those boundaries, how to make technology an ally in terms of efficiency, but also being mindful of the potential pitfalls of technology as well.
Certainly, absolutely. A lot of education. That's why we, as a technology company and healthcare, we're really, really excited about helping any university that offers teaching clinics, especially in behavioral health and mental health or addiction treatment, because it's so much easier for us when we're working with existing treatment centers. It's actually easier if they've been on a technology solution but have discovered it just doesn't meet their needs, and they move on to our platform, which is pretty much a single sign-on. Everything that they need is in one database solution. But those that are still on paper, you're absolutely right, doctor. It's a heavier lift for that practice. It's a heavier lift for an IT company such as AZZLY to bridge that, because they're so used to paper processes and their workflow, and feeling confident, feeling comfortable, believing that the technology is going to be there, believing that their notes aren't going to disappear, believing that that it is going to be more of a benefit than a burden. It is a heavier lift, so it's really exciting for us to know that there are teaching clinics like you out there that are bridging that gap, that no matter what the demographic, whether, like you say, they're coming right from, whether it's 20, 30, 40, 50, 60-year-old population that has chosen to go back to school for a second career, or they're just coming out of undergrad and they're deciding, I really want to focus on this profession. And labor-wise, statistically, this behavioral health in the labor market, it's one of the fastest growing labor pools because the need is so great. Would you agree with that?
There's definitely a lot of need, and we know from even our sister locations out in Santa Barbara and LA, for instance, at Antioch, that there's such a increased need for behavioral and mental health services. And there's likely to be a huge influx in need, and hopefully universities are able to keep up with demand and be able to train highly competent professionals who can think flexibly and compassionately.
I like what you said there, doctor, in that attending many conferences and hearing many panels on, what's going on in the community with mental health and behavioral health, and the anxiety and the increased depression and the isolation. Pre-COVID, we were hearing numbers of about 23 million between mental health, behavioral health, and addiction treatment that needed services, and only 10% were being served. Now they're talking 49 million. And what we feel that telehealth, maybe breaking down the stigma that it's okay to reach out. It's okay to share that you have anxiety or depression, or the isolation is getting to you, or potential relapse, and finding that a drug of choice is coming into play. It's okay to reach out. And I think on the employer level, I think that many employers have become more aware of employees that are now working remote, that used to be in incredibly social settings open workplaces where it was really a community of workers. Now being isolated, I think employers have to be more respectful. So, I agree with you, Doctor, in that the need, whether it's become greater or it always was there and it's finally being recognized, you're being there as an educational tool and to really raise the bar, raise best practice, raise the standards in care. It really starts in our view at the educational level. So we really thank you for all that you're doing and spreading the good word as well.
Yeah, definitely. And I know in our community we are pretty fortunate to have, for instance, even a local school district that values discussing mental health concerns and seeing putting on panel discussions and movie screenings as a way to help parents even in high school understand what things like anxiety and depression are like for adolescents. And so trying to remove that stigma as early and as often as possible, because once things become mentionable in some ways, they do become manageable.
At all levels, the foundation in education, the foundation in skill, you're being able to elevate the skill of any individual that comes through your programs. Definitely is win-win out there in the community and win-win for any health IT company when we do work with any facility that has that educational base and has that experience in the licensing that has taken place for them to get the degree and then go further on their licensing. It makes such a huge difference because they understand HIPAA, they understand security, privacy, they understand the restrictions that go along with using social media or texting or even telehealth, and being concerned as far as these are tools, but they have to be used properly. So really salute you, and I thank you for all that you do and all the support you've given the AZZLY team. Everybody here enjoys working with you. You did, again, jump in, full throttle and really embrace the technology that we offer on the electronic health record side for documentation. And there's a lot of tools that we're excited to, like you, we try to be at the leading edge, not necessarily the bleeding edge of technology, to really help support providers with the tools that can help them serve more. So thank you again for your time today. Derek or Ryan, you want to do a wrap?
This is Derek here. I wanted to ask you, to piggyback off of Coletta's point, we find that a lot of our customers that are addiction treatment centers, behavioral health centers, or counseling agencies, we find that they're able to set up their clients, their alumni, with the most successful treatment plan because they're able to kind of simulate reality, real life, what's going on, the stresses of life, the stresses of work, family, relationships. And I feel like that transitions well within what y'all have done within your program on the clinical side, is to make it as real as possible for your student clinician within the university to help train them and get them kind of used to charting, used to the situations that they're going to be dealing with, as well as helping with your student body. And then furthermore, with your community counseling center that you're doing, my question is there any advice that you could give other directors of universities that are also either looking to mimic a program similar to yours or as they're designing that? Because you got to imagine during this time, this has to be at the forefront and a top priority to directors such as yourselves, right?
Yeah, I appreciate that, because I think what we try to do and what we were able to kind of do with you all in terms of implementing in EHR is to think from the ground up about how we train individuals. And so students are trained to think flexibly, for instance, in terms of diagnosis and conceptualization. And so teaching them to not only think in terms of the ICD, but also the DSM and the psychodynamic diagnostic manual. And so we integrated those into some of our forms from the beginning. We also try to have individuals think flexibly. And so we trained them on understanding how diagnoses and conceptualizations change as more information comes in over treatment. And we think that's important because if you went to a medical provider and they said you had the flu and then later it turned out it was something else, you would want them to change course with their treatment, how they were thinking about your concerns. And so we try to teach students to think the same way.
Absolutely, and I think with what you're doing, Dr. Pignatiello, is that you're setting them up for success because you're preparing them for the real world. Like I said, just to circle back around, is there any advice for those other directors out there in similar positions of yours that are looking to implement this?
I would encourage them to think about what their training model is and how they can kind of build it into a system that works for them. So questioning how they teach their students to think flexibly, diagnostically, for instance, like what are their processes that exist and how that can be then implemented in an online structure. In a similar way, what we tried to look at when we were switching from paper over to an EHR was where the general processes and workflows that existed and where there might be redundancies and how computers actually do a very good job usually of remembering things. And so having pieces of paper scattered about might be useful in a paper world, but not necessarily in an electronic world. So that's kind of why I'd recommend is like look where those redundancies are and look at where you're starting from in terms of a training model and what you would want to see in an electronic system.
That makes a lot of sense. So kind of switching gears, Dr. Pignatiello, we spoke about your staff and as supervisors, how technology can help out. We spoke about how your student clinicians, how they're using technology to help with their processes and learning and the training. If you don't mind, do you mind sharing with us, how has this impacted the student body at all? How about those students that are going in for counseling? Are you able to help more students because of the technology that's been implemented? Can you speak a little bit about that?
One of the things that's been particularly helpful because of the recent executive orders and temporary changes in licensing laws has been some of the traditional standards around telehealth, for instance. We've been able to connect with students in a safe way. Even with COVID, we've been able to find hybrid systems where we can administer psychological tests in 2 separate offices to keep both the clinicians and the patients safe. We've tried to implement technology in ways where it provides the most benefit and allows for space to exist between 2 people, while also bringing them together in a safe and comfortable way.
So we've tried to implement technology in ways where it provides the most benefit in that it allows for space to exist between 2 people while also bringing them together in a particular way. And so we've been fortunate that we have clinicians who learn quickly and who are willing to adapt to these circumstances because we do see that there's I think like you had said, like this is kind of the real world and we try to train students in the real world. And that's going to mean interacting with telehealth systems in the future, interacting with electronic health systems in the future. And so we want to provide a large enough basis and foundation that they can come back and look at these experiences and recognize how we got to this point. So they can implement that when they're 5, 10, 20 years out from their degree.
Absolutely. Makes a lot of sense. Thank you for sharing that. I think it's great to come full circle and see how, just over the last couple of years, how things have been going at Antioch, and we've been really blessed and grateful to be working hand in hand with y'all, servicing you on the technology standpoint. We're seeing more and more universities kind of adopt the model that you all have been doing for a little bit now. Maybe you're not the originator of it, but we see y'all as being trailblazers, considering that you've been using a system like ours for 2-3 years now, and it seems like a lot of programs are just starting now to catch up, and it's probably due to this unfortunate circumstance with COVID. However, you got to think ahead all the time, and I think you've done a great job for your program. Definitely give yourself a pat on the back, and like I said before, we're really grateful to have you as a customer of ours, and we will share your contact info on the podcast. So if there's any folks out there, any of our listeners that are interested in learning more about Dr. Pignatiello's programs that he put together at Antioch University, we'll have his contact info in there. Just thank you for sharing your knowledge with us today.
That sounds awesome, and I definitely appreciate all your staff. They're always so wonderful and friendly, so thank you.
Well, y'all take care. Stay healthy. God bless.